if you see the other side, some of the countries like Japan, you take an example, South Korea, people don't get married there. Parenthood is a problem there. There's no urge only, and government is doing so much of work to increase that urge, because at a long term it implicates to the economy, because you don't have young population, if you don't have people marrying and having children. What's the future of the country? So two things very important: highest young population in the world, which brings highest number of reproductive age couple in the world, and also parenthood culturally important. It's very important in our country, which is so rich culture and so important. At the same time, we have ever-changing lifestyle, and there are many lifestyle reasons why people now find difficult to achieve parenthood. But I'll focus only on one: that the order of lifestyle has changed, which is education, then having job, then wanting to stabilize husband, wife, both male and female, career, lifestyle, and then thinking of parenthood. So, I mean, on a lighter side, I may not look, but I'm 50 years old. And I come from a generation where you finish your graduation, marry first, have your children, then think about home. Car comes very late, phones were not there. So lifestyle used to take a back seat, but parenthood used to take the front seat. Now it has changed in the current times. So it's a scientific evidence-based paper which I'm speaking, that in India, a woman peaks the fertility potential at 25. Whereas now, because of the changing lifestyle, where we male and female both marry very late, and then they think about kid even later. So we face more problem of parenthood in India today. So besides, when we copy Western lifestyle, a Caucasian woman peaks fertility potential at 31. Because of that, culturally, they used to marry late. So while we are copying Western lifestyle, we do not, our genes don't change. This brings an important topic, which I feel more emphasized to be emphasized, that we should be aware about this. And because of that, today, out of all the positive things, India has one of the highest number of subfertile, infertile couples in the world. And as per evidence available, published, India has 30 million couples who suffer from infertility. So it's important to spread this message and word, where we take an informed decision and we help them to achieve their cherished dream of parenthood.
Thank you so much, Vinesh. I'd like to now come into specific responses and changes that you've had, keeping the digital environment and the COVID situation in mind, where elective procedures and elective exploration has come down very drastically. And one of the things you mentioned in our conversation before is the concierge approach, which has come in. Could you tell us how the digitization is happening to connect with the potential parent to be?
So the first wave of COVID, when we stuck in 2020 March, it was an unknown enemy. Now I think we all know that it's a known enemy and is going to stay here. And if I go back dated thousands of years before, human used to live in caves, but we came out of caves and overcome all the perceptive dangers. Same way, I think now people have realized that we need to come out from our home and live a normal life. Now, coming to the specific to fertility, because in India, the awareness and acceptability is low about having subfertility or infertility. So, couple comes or a woman comes to the right place at right time very late, and they lose their very crucial ovarian reserve years. So say, for example, you are anyways late for attempting parenthood, and you again don't come to right place and right time because you are not aware and you don't accept that as a medical problem. Again, because of COVID, where there were restrictions of people wanting to come out for elective and non-emergency service. Again, if you delay it for 6 months or for 1 year, it becomes rate, and it significantly impacts the potential outcome of the infertility treatment. So this has become a very important tool of concierge services, where patient can be at home, and there are very technologically advanced online consulting platform where the whole consultation piece or whole counseling piece happens online virtually. You don't need to come to clinic. The prescription can be online. All the blood tests which are required to identify the problem can be done at home. So there are home services which are available, which are very professionally managed. Same day consultation can complete, same day all investigation can be prescribed, same day blood can be collected, and you can get results in 24 hours, and the whole investigation piece is completed. The advanced treatment also can start online. So out of the whole 1 month of treatment of infertility patient or IVF, where patient used to come pre-COVID maybe 15 times to the clinic, has reduced only to maybe 3 or 4 times. So this makes very easy for the woman or couple who are seeking help because they feel safer. The platforms are also very professionally managed, and confidentiality also is very well adhered to. And still they don't waste that 6 months or 1 year of time when they feel it's not safe to come out from home and go to clinic so frequently. So concierge services in fertility treatment have become not only popular in India, but popular across the world. There are very beautiful platforms like ivfbabble.com, janani.com in India. There are some beautiful platforms in US where patient practically takes the whole treatment virtually, excepting when they are physically required for maybe 2 or 3 times.
That's really interesting, Vinesh. I'd also like to, you mentioned trust and how anxiety, with the reduction of the anxiety of coming to office, automatically some amount of trust and it does get built. But it would be really nice to find out how exactly are you doing, how exactly are you helping potential parents have a trust in the process, given that now it is all digital.
So again, post-COVID, one of the most important disruption, but positive disruption which has happened is that for everything we seek help or we seek information in digital ecosystem. I mean, the Ubers and Olas of the world or Zomato and Swiggy have become extremely popular household name. But in the same way, even for subfertile, infertile couples, which are millions in India, they want to find help in digital ecosystem. So one is a very meaningful content, very meaningful content for couples, women who are seeking for help, and connecting with through the meaningful content with these couples, where they find where they identify and find help, and they reach at right place at right time. So a meaningful.
Sorry, go ahead. May I ask those who are not speaking to please mute themselves? It breaks the flow. Thank you so much. Sorry, Vinesh. Go ahead.
So meaningful content, connecting with the right audience and bringing them to right place at right time virtually is what which has evolved so much in last 18 months. Of course, the subsequent session of listening to all the very elite panelists will also help me to understand the piece better. But from our side, or whatever I have learned or we have learned as an organization, that this has become a very important trust building place for the couples. Second, in infertility, specifically for fertility treatment, patient goes through by look, they are not diseased, but it's a medical disease. It's a WHO classified medical disease. And to inform patient or to make them aware that it is not personal shortcoming, which is generally perceived in India. So there are, I mean, if you go through the funnel of these 30 million couples seeking help, the larger funnel is people who believe that it's a personal shortcoming, that I'm infertile. Very sadly, women suffers a lot in India, but it's not woman's problem. It's a couple's problem. 40% of infertility is because of woman, 40 is because of male partner, 20 is because of both. So creating this awareness in digital ecosystem is helping people to understand it better. It's a WHO classified medical disease. Second, it's not your personal shortcoming. So acceptability by developing lots of educational program and creating right awareness also reduces their anxiety. Also, when we create this educational program and content digitally, couples sitting at home going through the digital ecosystem, they will understand that they are not alone, and there are millions of couples, and it's like any other disease. If my husband is suffering from diabetes, he doesn't shy off telling people. Then why should I shy off telling people that we are suffering from infertility? It's like hypertension, cardiac problem. Infertility also is a medical disease. The last piece, which is very important, which has evolved post-COVID also, is there to give them counseling sessions. So we have trained psychologists who counsel patient so that they have a they don't have any apprehension for taking treatment. They don't have any doubts in their mind, and all their anxieties are addressed.
Vinesh, you're on mute.
Yeah, I don't know.
I was been
Vinesh?
put on mute by the host when we're putting for everyone on the mute.
Sorry, that was my mistake. So
offering psychological counseling session virtually and in person when they come is also become very important piece post-COVID, where we remove all the apprehension, all the taboos, all the doubts, and make them aware about the treatment and take through them the journey of parenthood seamlessly and as smooth as possible.
Thank you. That is, I think, a very important point. Vinesh, you mentioned that it's a couple's problem. It's not a woman's problem. It almost reminds me of the kind of stigma that which surrounded women and young girls who had TB and their marriage prospects, and the extent to which they hid the fact that they were taking treatment. In fact, I remember a very interesting story where there was a shoe shop in Gurgaon which had actually set up to distribute this, to keep the boxes of medicine at the back of the shop, and the girls would come in and on pretext of buying a shoe, collect their kits. So that is the kind of stigma this is reminding me of, and it's really wonderful that the kind of counseling efforts that you're making. A couple of last questions before we open it up for any audience reactions. Vinesh, what do you think the sectors can learn from your experience? Because it's not just the fertility sector, literally every medical sector, every industry literally has been impacted by this whole process. So what can we learn from your experience in helping people maintain trust at a very sensitive time of their life?
So I would put it very simple. Three things I realized, or it is emphasized most post-COVID, is to have a very meaningful digital content. The power of digital content today, I think everybody here knows it very well, but it has become so important and critical in last 17, 18 months. It creates lots of trust, I think, is created when the patients read about your services, your company. Second is to offer counseling to all the patients in every medical aspects of offering psychological counseling. I think it is more and more becoming acceptable. If you talk 5 years before, when we used to tell our patient that we want you to take psychological counseling because you're undergoing IVF, they used to say, do you think that I'm not sane? Now it's become like patient will ask, and it has become more acceptable, which is so beautiful. So offering right content on digital ecosystem, offering psychological counseling, and offering concierge service as much as we can. Calling patients at clinic only if it is needed. These three things is important so that the patients who are seeking help, they come to right place at right time. Also, I want to spend maybe 1 minute on this stigma piece. Since early 90s, I'm in field of infertility almost 3 decades now. And I believe that this is time now in this decade where this has to go. And all of us here can play a very significant role. That infertility is a WHO classified disease. It's number 3 in global burden, maybe after diabetes and hypertension. There are millions of women or millions of couples who suffer from infertility. And this stigma and taboo has to go. Where we can create right content that it's a medical problem, disease, and you have to seek medical help and achieve your dream of parenthood. It's a young science, infertility treatment. It's for the first IVF baby is 43-year-old now, Louis Brown. But there are more than 8 million couples across the world who have achieved dream of parenthood through IVF. So there should not be any woman in India or across the world suffering in isolation because of infertility. First, it is not woman's problem, and second, it's a medical problem like any other medical problem. So just go to right doctor, get yourself treated, and achieve your dream of parenthood.
Thank you so much, Vinesh. I think that's a great note to end the conversation on. But I have one final question. We during our conversations before this discussion today, we talked a lot about how corporate policies are evolving so that women can freeze their eggs and become a parent just when they're right, absolutely the right time for them. So internationally, we've seen a lot of this. Do you see that happening increasingly in India and not just with MNCs?
So it's in very nascent stage in India, uh, but it's a very potential aspect which is evolving in India. It's in nascent stage in India, but very potential aspect. So I know many large IVF clinics in Europe and US. For them, having patient one every day at least, where a woman walks in the clinic and they wants to freeze their egg is very normal. In India, it is in nascent stage. But I'll take on one step before this is that the life order, the choice has changed. It's a mega trend. And we all, I mean, none of us should be judgmental about this choice. Everybody has right to make their choice. What we can do is to offer help. So when a male and a female are wanting to delay their marriage because of any reason, including finding Mr. Right and Miss Right, or having career or their lifestyle, one thing which can be done very easily is to preserve your fertility, so that you are not losing your ovarian age. So your eggs can be freezed. If husband and wife have identified each other, your embryos can be freezed, so that then you can be free from this anxiety. Because the womb of a woman is good even in mid 40s, late 40s, right? Now this has caught up very well in US and in Europe. I think it is catching up now in India. Like large IT companies in US like Google, Facebook, they all offer fertility preservation as part of employment development in to all the women there in the. So there is one very big company called Progeny in US who have tied up with this large corporate. So from CTC maybe $10-20 it goes to Progeny from these lakhs of millions of employee, and then whoever is taking fertility treatment or preserving fertility, the treatment is sponsored by the company, but comes through an insurance company called Progeny. I'm in touch with Progeny that they should launch this service in India. I think in India, it will be more required than at present in countries like US and Europe. Of course, it is very well accepted there. So we are on the stage where it is picking up and evolving, and I think we will arrive there in next 5 years.
Thank you so much, Vinesh, for your lovely insights. And I think the one thing I took away from our conversation before and after is that people are not aware of the scale of the issue. And given the fact that in India, the drive for parenthood is very, very strong. I think you'd mentioned that 1 in 4 urban couples in India have a fertility challenge. So that's a huge amount of people, and a problem which, like you said, people don't openly talk about, a problem which affects perception of women more than anybody else. So
I'll tell you one small anecdote, Parul. Sorry. I met one of a very rich family couple in my lift 2 weeks before. 32-year-old female, very rich family, educated people, suffering from trying to difficulty in parenthood. When I told them that I run a chain of IVF clinic, and I realized that 2 natural pregnancy miscarriage, changing few gynecologists, they were not even aware that there is help available. And hopefully in next couple of months that couple will achieve dream of parenthood just by talking in lift from ground floor to 7th floor. Now imagine if this is a state in Bombay, in Navi Mumbai, where I stay in a good locality, and in a family which is they have no shortage of money, an educated family. Just imagine, my physiotherapist is a doctor and suffering from infertility. Family does not allow to take IVF. I mean, how can you accept that? It's a medical problem and it's a medical treatment. So there is so much which can be done to help millions of people across the world. Sorry to interrupt, Parul.
Not at all. Thank you, Vinesh. It's lovely talking to you. Please put in your questions in the chat box to a lovely audience here, and I'll have them taken up later after the panel discussion is over. And we're going to now slip into the panel discussion here. And before we do that, I'd like Ritika to share a major takeaway from what Vinesh has said. Ritika?
Absolutely. Thanks, Parul, and thanks, Vinesh, for such an interesting discussion. I'm so glad that we could kick off this event and discussion with something that everybody can relate to. I think one of the most interesting things that I find, as a storyteller, I think in healthcare, we are driving conversations, led by science on the one hand and by emotion on the other. So even in parenthood, I mean, nobody could have imagined, even today, people don't try to understand there is a science behind parenthood. So, some of the nuances that you have just mentioned, and, while you counsel and make the seeking couple more informed, I think once they understand the science behind it, the whole road to parenthood can be so much more easier, so much more comfortable. So I think that's the beauty of it. If the storytelling can be so effective, can be led by science as well as emotion, that will just do wonders and help India, and ease the journey on which we are, taking the parents to reach.
Thank you, Ritika. Thank you, Vinesh, for this lovely conversation. Just to remind all of you that we are now live on in YouTube, and the link is again here in the chat window. Please feel free to share it with your family, friends, and colleagues. We're just going to now start the panel discussion. Any questions for Vinesh, please put them in the chat box. And for the panel, we'll take them after the discussion. I know there are already some questions coming in from the panel, but I request you all to just wait till we finish the full discussion. I'll make sure that Vinesh is able to answer your questions later. Plus, also, we can all get them answered offline via email as well. But thank you so much, Vinesh, for an absolutely fabulous discussion. And now we come to our panel discussion. The topic is very important, connecting with patients in this post-COVID world, in a highly digitized world. And we are very lucky here to have such a fabulous panel here, which will bring us insights from a range of topics and subjects. And we also have a great audience from some of the leading pharma and health companies, the communication leads. So welcome to our lovely audience. Thank you so much for taking the time to join. So I'm going to kick off the conversation with Amir. Amir, what do you think the impact of digital health communication can be on reducing the health burden? I know it's a bit of a sweeping question, but will increasing digitization reduce pressure on the healthcare system?
Thanks, Parul. And thanks, Vinesh. That was brilliant. I mean, several of those things that I had no idea of. And you made it so easy and made it so important for all of us to be part of this exercise, because, to understand that that infertility is a medical problem and has such ramifications on mental health and so on is just amazing. So actually that is where I was thinking of what I was going to answer Parul with. Parul, there are 3 or 4 issues that I want to highlight. The first is that digital technology or digital access to healthcare removes enormous amount of stigma. That's the first point. We discovered that long ago when Narayan Murthy had once said that his driver would constantly go to the ATM every day. So he would ask him, why do you go to the ATM? You never went to the bank so often. He said, sir, the ATM doesn't look at me look down at me when I go and withdraw 100 rupees. The cashier does. And that's the issue with healthcare. When I go and approach a doctor, I'm very skeptical. Will this doctor laugh at me? Will she rebuke me for my sanitary habits, for my looks, for my clothes? But when I am across on the phone, and we discovered that we did a lot of work in Bihar for maternal health, and we realized how much women were happier contacting us on simple IVR phones. So that's the first point. It's really digital access is much more about hesitancy, about stigma, than it is about reaching the last mile, which is something that we have read about and talked about for decades now. The second thing about access to digital health is that it takes away this huge problem we have of forcing doctors to go to rural areas. Every now and then you say some smart alec health minister comes and says that I'm going to make it mandatory for doctors to go and do rural health before they get their degrees. I mean, this mandatory stuff doesn't work. You will just have lesser doctors coming in. And now what is happening is you can get access to the best doctors available online. We did that in Rajasthan in another intervention to great advantage, to great effect. And that is the second thing from the supply side. So the first was really a demand side issue. You're increasing demand by giving people access over internet and over telephone. And here you're supplying doctors by giving doctors access through internet and mobile and so on. The third thing that it does is that it is so much more efficient. See, the problem with a healthcare market is that a healthcare market doesn't have timings. Unlike other thing, unlike me, when I teach, I have a timing. I don't teach before 9 o'clock and I don't teach after 9 o'clock. But healthcare requires a doctor to be available all the time. And very often you find that patients suffer because they suffer accidents over the weekend, or fall down partying on a Saturday and can't get a doctor. So that is I mean, that was a aside to some of us, but that's the real case, that you have maximum fatalities happening over weekends. One, because one is irresponsible, but also because doctors are not available. So that's the third point that I wanted to make. And the final point that I want to make is a gender issue. And the gender point is that we have done there is now enough literature that shows how women adapt to digital technology much faster than men do. Across technologies. We've done that with weavers, we've done that with artisans, we've seen that in healthcare, we've seen that in education. And given the fact that access to health and education, and this is something that I would point all of you to the UNDP's Human Development Report, you find that if you look at India's poor indicators, there are several that leave you disappointed. But the one that really shocks us is the fact that we are among the most unequal in terms of access to education and healthcare in the world. And that inequality has a very strong gender component. And if the digital divide gets conquered and women get digitally empowered, then we are tackling that pernicious issue that cannot be tackled by other policy measures. So those are the 4 points I want to make, Parul. Thanks for asking this question.
Amit, that was, I think you just hit the nail on the head, and I want to come back to you with more questions on how will this reduce? You already mentioned a very important point: the stigma of going into a doctor and not having him look down upon you, and maybe even if you're well educated or come across as somebody from the so-called upper strata, many times women are ignored. Their problems are not taken as seriously. So that happens very often. So I'd just like to bring in at this point Rajiv Sikka sir, because I think it's a great segue to Medanta at this point, because Medanta, in fact, they're dealing they're dealing with all these issues every day. So welcome, Rajiv. Rajiv, as you all know, is the head of information technology at Medanta. And personally, Rajiv, I've had occasion to use the Medanta booking app, and it's very smooth and fabulous. And I must say, as a user, I found it very, very helpful. So Rajiv, my first question for you is that how did you ensure that the connection with the patient remains positive, especially in hospital like Medanta, which puts in so much effort into getting feedback from the patients and treating them as a valuable stakeholder? What has been the experience like post-COVID to maintain this trust?
Sure. So you rightly said that healthcare is a trust business. It's a word of mouth, and there are times when a roadside pan wala will tell you that this doctor is better than the other doctor, and probably you glue to that doctor. So that's the state of affair as far as trust is concerned in the healthcare. So in a typical tertiary care hospital like Medanta, there are more than 170 plus touch points in a classical, traditional and digital channel between a patient and the hospital. When I say hospital, it starts even before someone becomes a patient of the hospital. Someone started looking into the website, finding out the doctors. So we realized that, to have this, trust, you have to have personalized experience in this 170 touch points to the extent possible. And there could not be better alternative mechanism than to bring digital intervention into this channel. As rightly said by Amir, I'm also of the same view that, ATM is far more better than the teller, because ATM doesn't make a distinction whether you are wearing a suit or we are wearing a short, whether you are withdrawing 100 rupees or a 10,000 rupees from the ATM machine. And the teller story, whosoever is of my age group must have seen a teller in a bank. So that's what the digital is all about, to bring that trust element. I'll give you an example. I was on an operational study tour in one of the leading hospitals in the Western countries, among the top 5 in the world. So we were just talking, and somebody said that, there is always a trust factor. We don't know what could be the hygiene of the hospital. And it was like, we were shocked because it hit us. We realized that, we are probably one of the most clean, it's like a 5-star property equivalent. And somebody is telling that God knows what kind of hospital would be that. So we realized that let's bring a, element of transparency, which is nothing but derivative of trust, by bringing a 3D tour of the hospital on the website. So if you go to Medanta website, you'll see a 3D tour. How my MRI, machine will look like, how do you enter into the MRI, how a room will look like, how the OTs look like. Okay, so that's one simple example of bringing trust. If, somebody, I think Vinesh talked about patient advocacy and patient education in a tertiary care hospital where some of the diseases are almost, non-curable, or it's like terminal diseases. So how do you bring, trust? If your doctor is going to talk about it, it is not going to help. So you bring, fellow patients who have gone through the similar experience, how the journey was, and then we make sure that they connect to each other. And that's how, one more element of trust comes into picture. You took an example of booking an appointment into Medanta, and we all know that getting a doctor time is very, very difficult, and more so in Medanta. So what we have is that a simple mechanism. If you know the doctor name, it's like a book my show kind equivalent. You book the slot. If you don't know the doctor name, you know the specialty, you know the treatment, you know the disease, you know the plan. Because sometimes, it's a tertiary care hospital, you come for a second opinion or a third opinion. You have taken first opinion from a doctor and second opinion from Google, then you come to Medanta. Okay. So in this particular case, you just want to know that cyber knife. So you are aware of your disease, you are aware of the possible line of treatment, but you now want to go for one more level, which is a robotic equivalent of your treatment. So all of these permutation combination will lead to some doctors. Okay. And you can book the appointment then and yourself. Then we realize that, some elderly people, because generally 50 plus is the age group, which Medanta has most of the patient. WhatsApp is a more and better customized experience. So we have a WhatsApp. You can book straightforward an appointment on WhatsApp in 1 minute. You'll get a link also. It will give you alternative doctors. It will give you alternative locations. It will give you a payment link. So within one straight 60 seconds, you have each and every formality done. You can prepay it also. So you don't have to stay in the queue as far as you land in Medanta. So this is one example. 6-7 years back when I landed in healthcare, this is my first exposure of healthcare. Somebody asked me, build a digital strategy for Medanta. I said, I don't understand digital. I don't understand strategy, and combined together is a bouncer for me. So let's understand that, what a patient wants when he or she reaches a hospital like Medanta. So you come in an OPD, you come into a daycare, you come in an emergency, or you get discharged from a hospital. So whatever reports, bundle of papers, discharge notes, prescription you carry, we were of the strong view that you should have it in this mobile hand. And why it is? Because it will make sure that, like 5 years back, when Government of India launched mobile portability, you were not captive of any service provider. So we thought that let's bring doctor portability or hospital portability into the hands of the consumer, in this case patient. So that's what it is. So you have all your reports in this. God forbids, if you're traveling and you have some setback, you can be in any city, in any location, and have all your reports in a handheld device. So that's what we bring. So right from looking for a doctor, looking for an appointment, getting reports, knowing about a disease, knowing about a treatment, each and everything is digital. And that's the only way by which you can scale it to large extent and large population base. So this is my, I'll take a pause here, and this is my view of how do you bring trust into a patient journey in a typical tertiary care hospital.
Thank you so much, Rajiv. I'll come back to you for further questions. I am aware that you have a limited time with us today, but I'll come back to you. I'm going to now bring in Richa and then Neha and then Ritika. Neha, I think, sorry, Richa, from what Mr. Sikha has said, I think it's natural to ask you because you're the ones actually dealing with people and consumers and their point of view. Do you find that COVID has made people more accepting or more woke about seeking the right health information?
I think it's not just woke, it's become more like a compulsion for them, because COVID has for the first time brought in a lot of anxieties for anyone, like anyone who's even a part of the panel right now or watching this. We've become very anxious as an individual because we need information, and that's also because a lot of it is on the go, right? Like we're still discovering COVID as we speak, even the scientists and the doctors, and we also want to be part of that story. So for example, some of the bigger things that we started noticing in our community that was being talked about is the distinction between a common allergy and COVID. I mean, who would have thought that that would be the first pain point that somebody would bring up? That, I have pollen allergies, which manifest symptoms very similar to COVID. And how do I make that distinction? So these kinds of I think concerns have led to people making this is more like a compulsion now. You cannot step out of your house. And I agree, you're going to be judged by family, friends, including all doctors that you have, that, you're being hypochondriac and this is not COVID and that is not COVID. But truth of the matter is that when your throat hurts at 12 a.m. in the night, you are scared. So, I think at that moment, the first touch base that you have is the online information flows, and that cycle over the last 18 months of the pandemic has been a revelation for even us, who've been into this space for quite some time. I've been working on pharma campaigns for almost 6 years now, and yet the kind of a pivot, I would say, that I have seen is something else. People are just about wanting to participate and engage on anything that is about physical well-being or understanding therapies, even rare diseases for that matter. So I feel that's everything that's just being talked about has led to this behavior, that we don't want to be judged. Our smartphones are the most private conversation that we can have about our well-being. My Google searches, of course, open to a lot of tech companies as data, but is not open to my husband or is not open to my family members. That, what am I searching? What are my midnight thoughts looking like? And then there are obviously, amazing tech integrations like what Medanta has done in terms of booking, etc. That just become the next step for me. If I have discovered something, or if I am curious about having a conversation with a doctor as a second leg, that comes in, and this curiosity or this anxiety has really changed the course of communications today.
Thank you, Richa. A follow-up question for you before I go to Neha and Ritika. What are the channels that patients, potential patients, or consumers, health consumers are using? Preeti, may I ask you to mute yourself, please? What are the channels of communication that people are using to seek this information?
So, it is still Google. I believe that yes, there has been a rise of this whole influencers are important, and what are they speaking and how they're talking is of course extremely important in funneling the right information. But even today, the first touch point is Google, which is why we at Blog Chatter completely believe that more than influencers, having bloggers to talk about pharma or any evolved industry, we're talking about pharma, but say something even like finance for that matter, where there's a sense of responsibility in the conversation that is required. Even today, blogs form the crux And then yes, the social media part or the influencers and their platforms help in amplifying or aiding the conversation. But even today, if I were to ask you, when you are scared or when you want to find about something, or you need that extra information, will you go and find that influencer and see what they've spoken? No, your first initial jerk reaction would be that you would key in those words in Google, and then one of those posts would be of a certain blogger or a doctor blogger or somebody who's had long form content on websites, and that comes up. So I feel even today the primary behavior is still centered on Google. Yes, completely amplified, and I would say accelerated by social media platforms and how the influencers are using it.
Thanks so much, Richa, for that very clearly put viewpoint. It's Papa Google who is at the top, and the various offsprings of Google then amplify and give you. And then there is the black sheep WhatsApp who gives you a lot of scary information as well.
Yes.
So,
Yes.
so that is.
But Google has recognized it. So if you look at Google's strategy, they've taken pharma as a very important aspect of their strategy right now. I had mentioned even when I was sharing the quotes with you that 10 billion search results are related to health, and can you believe it? 10%, they equate 10% of the total searches that Google receives. So it is there. I hate to use the word, but it might become a cash cow for them. So they are very well aware that pharma is the space where a lot of digital chatter is happening right now.
That's great insight, and just the scale of that is mind-boggling. Just 10%, and those numbers. Thanks for sharing that, which are really insightful. I'd like to go over to Neha now. Neha, one of my questions is the questions of training. In our discussion so far, we've talked about the stigma of patients going into a big hospital. We've talked about the stigma of COVID itself. COVID itself creates a lot of stigma, and people look down on you that wherever you're traveling, you must have been careless, blah, 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 blah. There's a sheer scale of Google search results, which Richa talked about. What Mr. Sika talked about, the portability of the hospital in your pocket, which is not just now, but a 5-6 years phenomena, but has really, accelerated post-COVID. So keeping all these in mind, Neha, I'd just like to bring you in on the training aspect of doctors. Training can't stop. So could you share your views on that?
Absolutely, Parul. And like you said, training can't stop. And while a lot of people on a lighter note have this perception that, he's become a doctor and he's now just practicing, that's not the case. Doctors are constantly learning. They have their CMEs, they need to get their credit points, etc. So they're always learning on the go. And before COVID, learning and socializing would all happen together. We'd have these symposiums, we'd have conferences across the globe or in the country, we'd have roundtable meets, etc. And that's where companies like medtech companies like us, or even peer-to-peer learning. So there's a lot of peer-to-peer learning as well in the community. Not just us, not just the medical device industry coming in, but also physicians getting together with each other. So all of that also, forms the training aspect, and all of that would happen in a physical space. But with COVID coming in, I'd say the community, the physician community, has been very welcoming in adapting to the change. We did have our own, thoughts on how would they do it, but I think it's not very smooth, but it's happened extremely well. And it's happened in different phases, So for example, if I look at peer-to-peer learning, physicians have actually been able to convert their physical meetings into hybrid models. We're having these virtual webinars. So webinars was like a craze that happened in 2020. Every time you'd open up internet, there's one webinar happening from one pharma company, from one medtech company. But learning continued. So a lot of things became totally virtual and a lot of things became hybrid. Hybrid in the sense you would have very minimum physical presence, but the concept of live streaming really pumped up. So now we've been able to have, take a smaller room with just a couple of people who are teaching something, and you're able to live stream it to different corners of the world. So that's one of the ways through which training has not stopped. Coming to industry partners like us, we deal with devices that are extremely complex, and for for a physician to be operating them, we have a very strong sales force that constantly, supports these physicians. And in a usual scenario, the sales force always bees with the physician in the cath lab when a case is going on. But when COVID struck, this was a huge issue. But we were very strongly able to do this entire thing through a lot of virtual trainings, be it WhatsApp phone calls or Zoom calls or FaceTimes, and through all that, our sales staff was actually able to impart knowledge and give instructions, tell the physician on what you should do now, how can things happen. It's obviously not as smooth as it would have been in a physical space, but it didn't disrupt. It did not create any errors or any issues in the process of learning. And virtually, the support that the sales staff has been able to give to the physicians to ensure that there is no problem in patient care has been extremely phenomenal in the last year. And we're still continuing to do so. And it's actually now, made the physician also realize that you don't need to always call the rep in. Even now, if the rep is in a remote area, he can still support me. So that knowledge was not there. Up till last year, it was always like, if a physician needed help, they'd say, please come over to the cath lab. They wouldn't even want to discuss on the phone because they thought it's always face-to-face, But this thought process has changed, and the adoption to virtual learning has come in, and it's going wonderful.
This one more follow-up question before I bring in Ritika for her insights. Neha, do you think that the shift towards online training also means that there is some amount of monitoring at home as well happening? So what is your view on the growth and impact of that trend? Monitoring at home. So many of us would never even have an oximeter. Now we not only have an oximeter, a blood pressure machine, and some of us have even bought those EKG machines off the internet. So,
right.
So given all that, do you think that this will finally have a positive effect on the healthcare burden?
Absolutely, Parul. And I think to a certain extent, it is good that as patients, people are they're being more aware of the fact that they should have some monitoring devices at home. But they also need to know when is it enough, and they need to go to the doctor, which is like the most important aspect of all of this. Monitoring is good because you can keep a check on yourself, because I'll tell you of the experience that we've seen, majority of the visits at the hospital of patients are for follow-ups rather than new patients. We'd say like I think Pikasa would also agree to the point. We have a lot of follow-up patients coming in at the hospitals rather than the new patients. And all of that follow-up is because the patient feels that, I'm a high blood pressure patient and check karna hai, so we'll go to the doctor and do it. But now, because if you have the device at home, you can actually keep a check of yourself at home and reduce the burden that's happening there in the OPTs and in the hospitals, and actually keep a check on yourself. And only when you know that something is going out of hand is when you can schedule a doctor visit. So this whole thought wasn't there. Yes, sir.
So,
you said it very right, Parul. Just let me add to what Neha said. Absolutely on dot. So now, just imagine that 10, 15 years back, who could have imagined that aqua check or blood sugar, instruments are there at home? I do remember for my mom, and he used to say, who's going to do this? And now she do it regularly, 3 times a day, 5 days. Now, I'll give you another example. And this is, this is not about the cost part. This is how do you ensure that prevention is there? Industry is moving towards prevention, because we can't sustain, the gap which is there between the demand and the supply in a correction mode. We have to have a preventive mode. Now, what I mean by preventive mode, unless you measure it, you can't control it. And so measurement is important. That's the basic principle of maths and science, which we have, heard right from the day one. The other stuff which, which is catching up, and you also mentioned, is that there are ECG machines which are like so accurate. It's a 6 leads ECG, which is in some cases works almost like a 12 lead ECG. And in a typical traditional ECG, it's a very cumbersome process. You remove your shirt, a man has a lot of hairs on the chest, and then, it becomes cumbersome. Now, these ECG machines measure your complete rhythm in sharp 30 seconds. And in a hospital like Medanta, if it is through Medanta partner ecosystem, ECG comes to Medanta doctor, and it is manned or manned is the wrong word. It is managed by someone which is a cardiologist 24/7. Within 30 minutes, cardiologist will let you know 3 possible actions. Rush to an emergency wherever you can. Don't worry, it's normal. Third is that there is something. Why don't you come to OPD tomorrow and meet your cardiologist? So just imagine, and trust me, your neighborhood doctors, either pre-COVID or during COVID, doesn't have capability to do an ECG, and forget about reading an ECG. Okay, so you need a cardiologist to read an ECG, and few of us not even, and being a typical cardiac disease capital and diabetes capital of the world, we need to have such kind of mechanisms in place, and some of these devices and measurements will play an important role in ensuring preventive healthcare for the country.
Thank you, Sikha sir. That is really nice and very, very interesting insight. Home monitoring is for prevention and for knowing how serious the issue is. But like Neha also said, you need to know when you really need to go to the hospital. That's also important. I'd like to bring in Ritika. We've had some wonderful insights from our panel. But what does it actually mean when you have to communicate all this information, which involves both science and emotions, as Ritika had said? What does it mean for authentic and trustworthy storytelling? Ritika.
Absolutely, Parul. I think, there were some very good points made, like, Dr. Amir just mentioned that, women are adapting to digital platforms. Neha mentioned that, patients are becoming more comfortable with the idea of, real-time monitoring at home. Mrs. Sikha also elaborated about, the patient experience. So essentially, patient experience is absolutely defined by trust, when it comes, to adoption of, the virtual ecosystem of information that we have built over the last 18 months. And it was, when the COVID actually happened, it took all of us by surprise. And at that time, we were all in a state of, a state of panic, and we did not know that, how elective surgeries could happen, how we could actually, be safe when we go to a hospital. But eventually, there was information that was, talked about by, virtual healthcare, online consultations, telehealth. So I would say that we need to take the patient, we need to take people on a journey with us for any kind of communication, which, has 3 stages, of course: awareness, adoption, and leading to preference. And, trust is the most important factor that will drive preference, that will drive behavior change. In healthcare, the most important thing is behavior change. And how in these 18 months, today we say that, digitization is the future of health. I would say that this was not something we could have said, 18 months ago, because, we were still exploring, and it was, the pandemic has actually acted as a catalyst. But still today we are, just on the surface of it. There is much more to digitization that has to happen, but there is a trend. There is, greater acceptance of the virtual systems, amongst the patient. So as a storyteller, we just need to understand that our information needs to be much more factual, yes, led by evidence, and it needs to be relatable. Something that the patient, the caregiver, the healthcare consumer can relate with and can absorb. While it is dealing with science, it also needs to be empathetic. It needs to have that resilience. And I think that is the change that has happened. Today, we can see, so many videos. We can see, communication through infographics. We can see listicles happening, more snackable content happening. And I think that is the future of storytelling in healthcare, which is both science-led, but is also looking at the human side of, healthcare and using very, very innovative formats.
Thanks, Ritika. I have one more question for you before I bring in Richa first again. Ritika, what is your opinion about the spread of fake news which can happen? Because you have the anti-vaxxers, you have the pro-vaxxers, you have all kinds of ridiculous, recently Nicki Minaj, the rapper, she posted a tweet that her cousin's friend became impotent after taking the vaccine shot. And that became world news. You had the White House saying, we'll call you and explain. And they're only doing that because of how influential she is. So how do you deal? It's not just fake news; it's a highly irresponsible celebrity who has over 20 million followers who said something so ridiculous. So, what is your opinion on that?
No, absolutely. In fact, there's a saying that, acting on wrong information can kill. And WHO has actually stated that the pandemic is accompanied by an infodemic. And this is so true. If you look at India, talking about the vaccine itself, in a country like India, where vaccine hesitancy has always existed. It's, zooming into the pandemic, where vaccine is a very, very important weapon to contain the spread of the pandemic and, to come back to normalcy. Any kind of fake information around that has actually slowed the process. And we could see that, there is a lot of fake information happening regarding, the side effects of the vaccine, the efficacy of the vaccine. So here again, trust, plays a very, very important role. In fact, in India, there more than 67% of the news is, health related. It is doing the rounds on all kinds of social media platforms. If you will see during the pandemic, while there was a celebrity that actually played a role in making some misinformation spread like wildfire, we have had influencers and celebrities going out and asking people to not kind of consume information that is wrong, to not believe in information that is not authenticated, that is not backed by a resource. So I do feel that in healthcare, and especially in context of the pandemic, fake information can be really, really hazardous, because it can actually alter the patient behavior, to public health interventions. Trust again, they will not trust what the government is actually doing or how effective the vaccine is. And therefore, their response to the public health interventions will also, slow down. So I do feel that, fake information is something that needs to be addressed. In fact, WHO has done a lot. They recently did, with the UK government, they did this campaign called Stop the Spread. There have been messages doing the round that, you shouldn't, kind of do forwards or, just go ahead and make information that you don't have a source with. So I think that, there is much more that needs to be done. So in a viral ecosystem, of information, we really need to be aware of fake news. In fact, in media, we have, several, journalists who are actually talking about, busting, fake information. We have specialized media agencies, like Boom Live, and, we have veteran journalists who have actually taken up the case and talking more about it.
Thank you so much, Ritika. I'd like to bring in Sikka sir for one last comment. He's just told me that he has a hard stop and a hospital never stops, especially one like Vedanta. So I'd just like, one final comment from you before you leave us, Sikka sir, that what do you think, like Ritika said, digital is the future of health communication. Would you be able to identify for us one big trend for digital communication for hospitals such as yours? We already talked about explaining, the routines, the experiences of a hospital, so the patient is ensured. But what do you think would be the most important thing?
So if I think all the speakers talked about that there are behavioral changes which is happening in the patient, and we could have never imagined that 18 months back. Right from telemedicines to care away from the hospital. So one very clear-cut message, especially for a tertiary care hospital, which is so big, which has invested so much in the infrastructure, one message is very clear, and it's very ironical that in future, we have to, have care away from the hospital. Just imagine that after building such a large infrastructure, now we are, building ourselves for care away from the hospital, because, Neha also mentioned, Richa also mentioned, and before that, Vinesh also mentioned that bring patient whenever it is required, otherwise manage it remotely. And in these 18 months, patient also have realized that, care can be given away from the hospital, and especially for follow-up patient. And follow-up patients includes mainly diabetic, chronic disease management, neuro, and cardiac. So that's the major load, and we have been able to manage. So this is one message. So what it means is that we have to have a communication mechanism in place, and that communication, when you talk remote, you just translate and say it's a digital. Now, in this particular case, when Government of India came out that patient can be treated at home with minimum symptoms and asymptomatic and stuff like that, within 48 hours we were ready. And at that time, trust me, we went to local district magistrate, civil hospitals. What is the meaning of remote care? Nobody was aware of it. But within 48 hours, we realized that it has to be a mix of digital and personal communication. So we came out of the form. Patient was having oximeters and other stuff. They were feeding it into a form. As soon as those stuff were below a threshold or above a threshold, alert used to go to a doctor, and doctor used to pick up the phone and call. So doctor is only treating someone out of which are at 20% of the patient through connect. Otherwise, each and everything is normal. If each and everything is normal, nurse is calling the patient twice in a day. Don't worry, things are okay. And that's how we treated tens and tens and thousands of people in remote care. Otherwise, no country in the world can afford to have those many patients in the hospital beds. So care away from the hospital will be the new way of treating patients in next. I'm not talking of next 10 years or 20 years. It's just it's given. It will be there in next few years to continue, and it will mature not just for simple diseases but also for other tertiary care serious diseases. I'll give you another example. We started moving patients after TKR within 3 days. It used to be 7 days. So what's happening is that TKR is like knee replacement, and we used to have physiotherapists doing 2 hours of physiotherapy in a day, and for rest of 22 hours patient is just seeing the roof, nothing else. Okay, so why don't you send the patient home, send physiotherapist for 2 hours, morning, evening, whatever is the routine, and just imagine you are freeing a hospital bed. Patient is not having an infection, because hospitals are full of infection, whether Vedanta or a typical any other hospital. So your message is treatment away from the hospital is bound to stay. And whenever we talk about remote, it is digital. So digital is going to play an important role in healthcare industry. It is going to play an important role in all the industry, but I think healthcare is going to be probably taking a leap forward step in this particular journey.
Absolutely.
Thank you so much. Thank you so much. That was a wonderful statement to end it on. The hospital is not only in your pocket, it's away from the hospital. Your treatment is at home and in your pocket. So thank you so much, Sika sir, for joining us. Really appreciate you giving us this time on a Friday. Thank you. I'd like to now take the conversation back to Richa, and then Amir, and then Neha again. Richa, going forward from what Ritika talked about, the fake news, the infodemic that she talked about. We also talked about in our conversations below, ahead of this session, that how do you ensure there's such a big rise of health influencers. Typically, companies are always really a little apprehensive of B2B influencers and what kind of value and authenticity they bring in. And given the very highly regulated pharma and healthcare environment in India, what is your take on credible health influencers of the future?
So I feel like when it comes to pharma, there is a mix of influencers also. One would be somebody who's certified. So it could be an HCP in whatever format. I mean, it could be a doctor, it could be a dietitian, or it could be somebody who's certified to provide certain information. And then there is the second kind of influencer who is not certified, but has a certain amount of clout, which he or she may have built just by, sharing anecdotes, sharing a lifestyle, showcasing a world that, they have been experiencing. The first one is open shut, their pedigree itself talks about it. So that's not a difficult aspect to deal with. The difficult aspect to deal with, of course, is the latter one. And we keep talking about, which again, I want to bring to light, even if there are marketers out here, that there is a conversation that keeps happening. The perception is that there's so many influencers, their influencers are cropping up by the minute. But let me tell you, the reality is that the actual digital consumption cycle, which is the demand supply, is still skewed towards demand. So there are more and more people wanting fresh content, unique content, different takes, new names, and there aren't enough influencers able to supply that particular concept, which is why I mean, I hate to be politically incorrect, we have trashy influencers also getting a buck today, because that is what's the deal, is that there's so many people wanting to consume content, and healthcare is not a different sphere in that case too. So for people like us who sketch campaigns, who try and build these kinds of tracks for brands out there, this is the biggest challenge. How do we select the influencer who does not come with any certifications, who does not come with any kind of a pedigree associated in the space, but yes, should come to a decent credibility. So here, the content that they are sharing. For example, if we are doing a content campaign with them, every single data that they mention must have a reference of a medical reviewed document, and these are the kind of rules that we have set for ourselves. So the right kind of partners in pharma, the right kind of associations that you build, either it is an aggregator like us, or it's a digital and media platform that you are associating with, or even if you're working directly with an influencer, the selection of the partner changes the game. So that is on the delivery end of marketing, communications, etc. But if you look at the overall healthcare communications, an average patient today still is very much confused on what is right and what is wrong, and who should I believe and who should I not, and they're still getting a little lost in the information. Informatic is a very interesting word to use, that is being put out there. So that is the menace that we are dealing with on a continuous basis, and I wish I could say that there is a permanent solution. ASCII guidelines have been a great step. We have been using FTC guidelines from the day that Blog Chatter was created, which is the US equivalent of ASCII guidelines, and they are fairly easy, lucid to understand, how they are operating. ASCII guidelines, of course, still, we are not seeing that much of adaptation as we would have. But we are very happy that the pharma brands that we work with are very particular, even before ASCII guidelines came into the picture, that you have to have certain checks and balances on the content that is getting generated. But when an average patient is discovering that content, it may or may not fit the bill, and that is where the ambiguity is lying, like a Nicki Minaj incident, right? I mean, all of us, Dr. Fossey himself had to come and take a press conference on it and mention a soundbite related to her. That's the kind of, I would say, damage, like the scale of damage that we're looking at, that that one of the world's top scientists has to come and quell the negativity or the incorrect information around a certain subject like this. But I think moving forward, that is the challenge also. How are we dealing with it, and what is it that we are doing? I was again going through a Pew Research study which said that 67% of the internet users are aware that they have either perpetuated fake news or become victims of it, which is a huge realization for an average person to have on an average day, that I have become a victim of an information, which is not right, which can affect my physical well-being. So this is where I think a lot of us can come together. Brands I know are coming together. Every time that I speak to a brand, this is one of the line items that we are always dealing with, which is how do we bust the myths or misinformation related to a certain therapy or related to a certain space. And I keep saying this maybe because I'm a little partial to pharma as an overall communication basis also, that the beauty of marketing in pharma is that the brands are not looking to sell. They're really looking to partner a patient make the right call. Whether the right call leads to them or leads to their product is another concept altogether. But at heart, it is that they want to help a patient navigate, onto the right therapy. And misinformation is something that's very new, which is really coming up. And suddenly I see a lot of pharma brands are completely focused on it, that this is it, this is the next challenge for the patient, so this is the challenge for us as well. So
yeah, absolutely. If I can just add here, I think Richa, you would remember you and I have actually had conversations around this, and how we have worked together on mandates where brands are particularly careful about what kind of information is reaching out to the people, because I have worked with brands who have said that our main objective is to help people lead better and more productive lives, and if we have to be source of information. We may do less, but whatever we do needs to be authenticated. And every brand wants to. In fact, that brings me to a point that if you see the reputation of the pharmaceutical industry, I think the industry in itself is on a reset button. 18 months down the line, the reputation of the pharmaceutical industry was, I think, even below the the retail and the real estate industry. But now, if you see, I mean, the reputation has undergone a sea change. Because the way the pharmaceutical industry actually collaborated, for bringing out the vaccine, for making the rollout possible, and because people realized that what innovation can do. So I think that's a huge opportunity. And again, I would bring back the factor of trust, that how the trust factor helped a lot in actually elevating the reputation of the industry, which is not difficult to not like. It has been faced by such a big trust deficit, but now it is improving, and we do see that it's an opportunity for the industry to go for an image makeover.
Thanks, Ritika. I just have a last few set of questions, and I'd like to bring in Neha and then Amir, who's been very patient and not spoken to him for a bit. Neha, what Richa and Ritika both have talked about, the whole issue of trusting the process between the patient and the doctor. Now, when it comes to creating trust, your confirmation bias is a concept called confirmation bias, and you would tend to select that information which feeds into your own bias, and you would believe that very more easily, which is why fake news is so effective, because it confirms your point of view. And so given those kind of scenarios, as someone who is in the medtech space, what is your point of view on fighting these kind of impressions, then the whole bit of digital communication, especially when, like you said, for you the important part is also to educate the patient thoroughly on when it's okay to stay and when it is not okay to stay at home.
True, Parul. I think a lot of this also is that we see is a relationship between the physician and the patient. It's very important for the physician to get the patient to be confident enough to figure that what is right and what is not right. And with COVID coming in and everything becoming digital, doctors are now also kind of instilling that confidence in the patient that you should go digital, but look at avenues which are correct, which are not correct. So it's a lot about educating the patient via the doctor, and also, like Richa said, there's self-education. So there's so much information everywhere that as individuals, even you need to take the right call. And I'll give you an example. I was at an event yesterday. It was a dinner event with a couple of people. It was more like a very small social gathering. And I happened to meet someone who was not vaccinated even one dose. And it was shocking for me to see in Delhi NCR, I met someone who's not even been vaccinated even one dose. And for a moment in that conversation, I thought my throat is aching, which is extremely not right because I'm fully vaccinated. I took time out from the gathering to sit with him and understand also that why did he not do this? Because I'm from a medtech company, I want to understand why you didn't get vaccinated. And he said that there's so much information. So I was waiting for the right kind of vaccine. And I said, what's the right kind of vaccine? He said, some say Covishield is better, some say Covaxin. But I was waiting for Sputnik, but Sputnik never came. And I said, oh God. I said, you can't be like this. Humans like beggars can't be choosers kind of a situation. You can't be like that. So there is still that. I mean, there's an amount of population in our country who still are reluctant to get the vaccine because they think they don't know which is right and which is not right. And I think here is where the physician role does come in. So obviously, when you get diagnosed for the first time, if it's just a common cold, you're obviously consulting with a physician. It's very important for the physician also to, let you know what exactly is correct, for them to give you some things to read on. So I remember when someone in my family got COVID-19 and they were doing a virtual consultation with a physician, the physician did suggest that, you can read up more about this on this website, and you could go to a certain app and read more. And they also kept emphasizing that you need to stop looking at WhatsApp University. You need to stop looking at all these other fake news that come all the way. So it's a lot of information that you get to know from your physicians, from your peers, from your family members. So me being in the medical device industry, I still continue to educate people in my family. I still have my father many times send me random forwards which says that, this prevention cure has come up for this disease, and now you'll not get cancer if you eat 5 leaves of this plant. And I'm like, no, this is incorrect. And most of the times we ignore, but I think we shouldn't. If you feel it's like, you should also inculcate that education in others. So I continue to do so with people that I meet, but particularly for patients, I think it's a very important role for the physician to bring in that confidence in the patient to understand what is the right medium from him to consume information. And obviously the physician is a role model for him there, so you're bound to listen to what the physician tells you.
So we've been speaking for almost an hour. I'd like to bring in Amir for a final question. And I'm getting a lot of audience questions, so I'd rather open it up to that now. So Amir, my final question to you, which I think is a very important note to end our panel discussion on, is the impact of the health burden on the economy. In the past, there have been very many credible studies which shows that public health diseases like tuberculosis, malaria, HIV can shave off as much as 1% of the GDP. That's the extent of the impact it can have. And yet, for a preventable disease like TB, we are also the tuberculosis country or capital of the world. 30% of the world's cases are in India. So given this in mind, policy-wise, what are your views, Amir, on allocating more percentage of the budget to healthcare, and also from that budget now, given what we've heard today, the sheer importance of education and digital communication, what would be your views on how to walk down that path?
Wow, thanks, Parul. You've given me 2 minutes to speak on a topic that would take 2 hours. but very quickly, you see, one thing is that there is now the heartening feature of modern policy is that we seem to have understood the urgency in tackling diseases like TB and Kala Azar, and we have set, definitive goals. There are clear targets. We've said that 2025 and 2027. It might have got adjusted a bit here or there because of COVID, but at least we have something to go with. Unfortunately, the big problem remains what Neha and Richa have so well pointed out. Look at how we tackled COVID. We are taking the US example. Look at what happened closer home. We had one of our most famous Babas telling us that, modern medicine is useless. It has nothing to do with thousands of people have died, he declared, taking medicine for COVID. Now, Baba Ramdev is a very influential person. The IMA came down very heavily on him, but it was too late because by that time, the previous health minister was endorsing whatever, drug he was peddling for COVID. So the kind of message that we sent out from the very top, including all those things that we did about, empty vessels and diyas and whatever, that did create a lot of demand problem. Neha, I was very envious that she's going out and having dinner with other people. We are not, and but unfortunately with people who are not vaccinated. But there is in our country we have a curious issue. That is, we have a supply problem, right? We don't have vaccines. We don't have enough vaccines even today. And there is a demand problem which is created by this kind of misinformation. So I think that was very well highlighted by everybody here. On your point, Parul, I've been teaching health economics for 25 years now. And if I take out my notes from 1998, the first slide, what it says is, we need more money. We need to allocate money, as a percentage of GDP. It should not be 1%, it should be 3%. 1998, that is when we said it first, or maybe earlier, I said it first then. And I'm still saying that in every session, that it should not be 1%, it should be 3 and 4. Ayushman Bharat, I was so happy that here was something that would give us a definite movement forward, but God knows where it has disappeared, like Arogya Setu. So the problem is that we are fighting these battles. We take one step forward and we go back 2 steps. I think it is high time that, like we have done with a new education policy, where we have committed that we are going to increase spending to 6%. I think that is what we need to do to be able to fight these infectious diseases. The last bit, the postscript, is that if you look at all the calculations that we economists are doing on GDP growth rate, that the ADB has done, that the UN has done, that the World Bank has done, all of them point out to the fact that the only thing holding back India's growth rate from going back to 10% is COVID-19 vaccinations. Full stop. It is vaccination. That is all. Once we get to 80%, and sadly we are still at 15 and 16%, then we can seriously talk about increasing growth rate, which will help us increase employment rates. So your point is bang on. We need to ensure that this policy implication of vaccinating more and more and vaccinating a sizable percentage of the population, which in our case will be 2/3, will be the bulwark, will be the foundation on which economic growth will rest. Otherwise, we can bid goodbye to another 2 years of economic growth. So thanks, Parul.
Thank you so much, Amir. And with that, we wind up the main points for the panel, but we still have many points to cover, including media education. But first, I'd like to go to the audience who've been asking questions. Ritesh, you wanted to come in with a question. You could ask it yourself. If you can switch on your camera and come in.
Thank you, Parul. Pleasure to be part of this discussion, and great insights in terms of learnings on health communication, especially on the snackable parts, and how a lot of information also, like a curious case on how Neha has brought it up, that one person was not vaccinated in single dose. And my question was related to that case and what Ami just mentioned about the percentage level of vaccination. Do we somewhere feel that the importance of public service announcements on and driving a campaign like that vaccination bhi sahi hai, is the key in essence to drive all of and put an end to this? Because I mean, I get bombarded with 10,000 messages daily with some sort of a campaign from the government, but why aren't we prioritizing this one single factor that matters to our life? And that's what I want to get views on, the importance of public service announcements, PSAs, as a part of health comms. Thank you.
Thank you, Ritesh. Who would like to take that first? Richa and Amir and Neha?
I think it's a very it's something that Ritika would be able to shed light more on, considering she's the comms expert here. But I also, before Ritika puts in, I also feel that the government has been quite active in telling people about the vaccination. I mean, every time I call someone, 10 minutes are gone listening to that automated message, which I always feel, if I have an emergency, I'm going to lose that person because they're telling me to get vaccinated. But I think more than the government, it's also the whole misinformation piece that we were talking about, which is kind of, confusing people, and people aren't, which we feel shouldn't be the case, because it's almost been a year and 2 years now, and people do understand the importance of vaccine. But somehow this whole comparison between 3-4 vaccines, the whole misinformation piece is something that I think needs to be tackled more. But yeah, I'd like Ritika to,
Absolutely. In fact, I have been working, thanks, Neha. In fact, your case of that one person has been intriguing, and, it has raised a lot of curiosity. But actually, I've been working in the area of value of vaccines, for a long time. So while we are talking about the COVID-19 vaccine hesitancy as an issue has existed in India for long, whether it is the cervical cancer vaccine, whether it has been the pentavalent vaccine or the HIV/AIDS vaccine, there has been a lot of, vaccine hesitancy. And especially when we come to COVID-19, because the vaccine had to come out in record time, there was even more inhibition, around, the efficacy of it. So of course, I think the government is playing a very, very good role. Today we have a very, of course, the pace was slow, but today we have a large number of people who are, fully vaccinated. We have a large number of people who have got their first dose and moving towards the journey of being fully vaccinated. But this journey has not been, easy. And of course, like I said, in terms of communication campaigns, I have personally been involved in a campaign on COVID-19 vaccine itself. And there, what we did was to drive the communication, by science. Of course, led by, the experts. In fact, I have liaised with, Dr. Khan, I've liaised with other experts to, really talk about the science behind the vaccine. Because once people can understand and, really appreciate the science behind the vaccine, and, the whole question about which vaccine is safer, which vaccine is best will not become so prominent. The government had already said that, any vaccine with more than 50% efficacy, you can take it. But then there were several vaccine manufacturers who were talking about how their vaccine has more efficacy. There were Lancet reports, really talking about, that this particular vaccine is efficacious. The survey has been done. But ultimately, it is about the fact that you need to take the vaccine as our core, weapon of defense in containing the spread. I'll give you a small anecdote. I know everybody has, workers at home. I have my home health. And to be very honest, Richa, like you saw, a person who was not vaccinated till now, my, house help, got her husband vaccinated only about, like a week or 2 weeks, the first dose only 2 weeks ago. And that too, when I had to press a lot and, explain to her that vaccine is important. And even after that, to my disbelief, she actually, created a ruckus saying that her husband is saying that, the vaccine has created more problem. I was feeling better when the vaccine wasn't there. Only because they believed on this whole thing about the side effects. They could not understand the science behind the fact that, okay, I will get some fever, I will get some body ache. So I do, here again, the whole storytelling needs to be simplified, while also led by facts and the science of it. I hope, Ritesh, I have answered your question.
Thank you. Then probably it is now about driving it about the information that is right to be heard by the audiences and about efficacies, and maybe PACs, like the service amounts could be focused on that, I believe now, from not only from government, but maybe from many organizations is what we have to drive.
Organization experts, like we have, the doctors, people who have worked in the vaccine space. I have always believed as a communicator that my audience, who is the beneficiary, who is the patient, has believed on what these influencers, people who they can believe, people who they can relate to, they believe in them.
Thank you,
add a point to the question Ritesh was making, right? I mean, I have a very simple point from the fact that I think you're giving a lot of ownership to the government. Government's role is to facilitate, right?
Yeah.
It has to be backed by science still. So if government's putting out something, it still has to be backed by an expert, right? And that is where I think the challenge is happening. And I'll give you an example, right? There are a lot of conversations that have happened here, which have come out saying, single vaccination is also good. Double vaccination is good. You go to other countries, my own sister is now on her 4th vaccination, right? She's getting vaccinated for the 4th time. So she got 1 vaccinated, 2nd vaccinated, and then the country started saying, no, you can take 2 more. So now she's going for the Pfizer vaccination. So I think the part where the misinformation and the gap starts happening, and it's not related to the government, but it's the point of view and the evidence-based backing from the right channels that comes in. And then what you do from a communication channel perspective becomes more pertinent. Then you can do PSAs or social media or interviews or whatever. And that is why I think in the US, the model worked a little better, because they had one scientist becoming credible voice, and then you can question him or not question him. That's a different debate to happen. But I think the challenge that happened here in the initial, which I think is now beginning to get sorted out, is the fact that we didn't have a single source of credible kind of voice coming in and talking to us. And I think that is beginning to happen. The other part is that you have to also understand there's a scale challenge in India. I mean, we're doing 10 million a day in certain parts of the world. The whole country is covered in that, right? So
Yeah.
I think we have to look at India in that perspective too, in terms of how the scale of the challenge that holds in front of us. But I think the credibility, I mean, ultimately it boils that becomes, I think, the most important point. So, I mean, all in all, I think we give too much responsibility to the government. I mean, it's really not their role.
Thanks, Abhishek. That's very important. But I'd just like to add a quick point on that before I go into Preeti Binoy, who has a similar question. I think vaccines are always controversial. I've done some work on the polio vaccination drive, and one thing which really helped was peer educators. Finally, they are the final say. Your community leaders. At the end of the day, you're not going to trust the doctor. And in the case of polio, it was the Asha Didis. As I don't know if you are aware of the Asha Didis, who are really the backbone of the rural healthcare system. And these Asha workers were the ones who helped, and also directly from the community. And I saw this also in infant feeding practices, where they were being encouraged to breastfeed and not go in for other supplements. Over there also, they had to work very strongly with the community, because there were so many myths about breastfeeding, about whether you need them, why you don't need to give water when the baby is breastfeeding. So these two campaigns, we can draw information and help from that. And peer educators are extremely important for vaccine hesitancy. The pentavalent vaccine that Ritika mentioned, why the media needs to be educated. There was almost like a campaign run. I won't name the paper, but the paper actually ran like an anti-pentavalent campaign, implying that Gates Foundation had like Microsoft had invented in the vaccine makers, and that's why they were pushing it in India. They were pushing it in some 12 or 18 states, and so that's how dangerous it can be. So peer educators are very important. Your neighborhood DDs who you need, people will listen to finally. I'd like to bring in Preeti Binoy. Similar question for Neha and Ritika about people who've not taken vaccines. Her question is that some people can have severe allergic reactions to the vaccine. So how do you message them, and how do you interact with those people? Because it may be she says it's a very small population, but how do we go into deep diving into this with the allergy aspects of it?
Hi, Parul.
Hi, Preeti.
Sorry, I just managed to change my place from a crowded position. So hence just put the question on the chat board. Neha, so apart from, thanks. So Neha, apart from the person that you met in Delhi, you're virtually meeting another one who's not vaccinated at all, myself. Obviously, and that's the question that I have on my mind, right? I've been leading communications for a healthcare company in the past, and someone who's really pioneered a lot of vaccine boosters and doses across various disease conditions. There is a lot of ambiguity within the medical space currently in India, and I specifically bring this example of acute urticaria, which is an allergic condition, right? If you see the medical community, and I myself have been visiting, I think, more than a dozen doctors who have recommended me not to get vaccinated at the moment, because the outcome of the vaccination, my current urticaria condition, would be an anaphylactic shock. And you definitely do not want to be dying in 30 minutes with a vaccine shot. Rather try and survive and live in a condition, in an environment where you can really secure ourselves. Just to add to it, I'm a COVID survivor myself, and I try and ensure that I am able to educate people on that. But my question comes back to, how do you educate that population? Because I'm sure with Ritika would also agree, a lot of data is there outside. Unfortunately, I could not really pick up the exact data to say urticaria as a condition is really picking up in India. Right? Earlier, it was just known as hives, but now more and more people are actually going through the unfortunate disease, which also apparently is related to stress. So in a condition like this, where you have this kind of ambiguity, you're a learned person, you're not just trying to choose between A, B, C, D brand, unlike you would do for your garments. How does possibly communications help play a role? specifically from the perspective of vaccine manufacturers, or even possibly if we could think from the government's aspect, right? Because urticaria possibly then sits as one comorbidity. There could be multiple other comorbidities as well.
So Preeti, actually, my mom has urticaria and she's taken both the vaccines. And I completely agree, both of you are different cases. And when you said that your physician recommended you not to take a vaccine, because what we always keep saying is that it's the physician who's supposed to make the patient or the person confident enough to take a vaccine. Now yours is a case which is completely, I mean, it's a very new case for me, where your physician has recommended you not to take a vaccine. But I still feel, while this is one particular case, for the person that I met was who couldn't choose, that is also a certain large number of the population. So I feel maybe this education that is going out, which says vaccine lagao, maybe that also needs to mention and talk about the side effects, or also talk about what are the things that could happen, or also mention how it is important for you to discuss with your physician before taking a vaccine if you have a condition like this. Maybe now what the communication does go out is go get a vaccine. Nobody is actually saying that you need to. So if you do have a problem, if you don't have a problem, go out and take a vaccine. But if you do have an issue, you should check with your physician and then get a vaccine. Maybe that point is not getting communicated enough, for cases like you. And that is something that as a patient, a person needs to constantly be in touch, with the physician who's treating you for your particular condition, or who's giving you guidance. Maybe that is one way that they could actually figure out in this whole journey as to when would you be able to get a vaccine. Because I don't think that you would never be able to get a vaccine. So if your physician is guiding you, there possibly would be a time where they think, now it's safe to take one. And with these whole booster shots coming in, which they say that all of us need to take by next year, even if you're fully vaccinated. So all of these new developments coming in, I'm sure there would be more as well. And that's very much on how connected you are with your physician. But for a situation like yours, where you said your physician only asked you not to take a vaccine, it's a very sensitive area for me to say that you still should take one. So.
Absolutely. No, I mean, just to add, I think, Neha, you made a great point that, while we are talking about the fact that, you need to take a vaccine, I think there are other areas also to be covered, though sensitively, because in India, there is, and anywhere in the world, because there is a tendency to generalize, certain information. So, we will need to make, like I said earlier, also healthcare communication needs to be more nuanced. And therefore, when it is led by science, when it is coming from the expert, who will then be, conscious of covering all these aspects. So like we say in a simple press release, we need to cover the 5 Ws. Here also, in any kind of information, we need to cover that, who needs to take a vaccine, where they need to take a vaccine, how, and, what are the other aspects that need to be taken care of. So again, the patient connect, if it is if it is any other patient or person who is eligible for vaccine, or if it is a special, I mean, not a special case, but someone who may need a more, kind of a more nuanced information, is also an audience. So again, our information and storytelling needs to be maneuvered accordingly.
Absolutely with you, Ritika. Sorry, Parul.
No, go ahead.
I completely relate to that. And, as a communicator as well, it resonates absolutely well, right? Because when you craft a press release, you address the 5 Ws.
Exactly.
And I think that's a fantastic way that Pfizer and Moderna have been doing this in the United States and UK. So if you look at all the research papers across as well, I've been trying to reach out to colleagues based over there just to understand the vaccines in general. Urticaria as a condition is very normal in the United States, right? There is so much of literature available there, right? So obviously people even suffering from urticaria conditions do have the option of deep diving, understanding which condition they have, and then looking at what is the ideal or recommended vaccine. I think that's a big area that's possibly missing. And I think all of you really beautifully touched upon it. And that was the whole idea of my question, is that we need to now start looking at education on COVID from a more deeper lens, rather than a very widening scope of just saying, okay, please come and get vaccinated, because we as a country need to ensure that we have another world record. So move beyond world records and just get into, I think, more deep diving healthcare communication or help, if I could say.
That's
I think I'd like to add to that, Preeti. I think it's very, as a communicator, all of you know that you have to start with macro to micro, especially when it comes to a topic like this. That communication campaign will evolve. Right now, it is difficult enough to get people into the room to get vaccinated. So we are still at that stage of communication, and it will evolve. It will deepen. And I'm another person whose neurologist told me don't take the vaccine because I suffer from debilitating migraines. So I was told don't take it, but I still took it, and I'm okay. It's not that my migraines have gone, but they haven't like significantly gone up also post vaccine. So my experience was very good. So I can't, and it's against my doctor's advice. I did go ahead and do that. The second part of it is, which I think, Ritika, if you can make one final comment before we wind up for the evening, is that when you come to vaccines, don't forget that never in the history of the world has a vaccine been developed so fast. And we are trying to pace the information at that same rate with audiences who have to also catch up, which includes the media. So it is a very difficult task. And like Abhishek rightly said, the scale is mind-boggling. So I think if we'll get there, I'm very positive. So one last point from Ritika on education of India, and I think we really have to wind up. It's been 2 hours.
No, absolutely. And, the fact that, we are constantly discussing this, shows that, I'm hopeful that the discussion was very interesting. I myself thoroughly enjoyed, the points made by all the speakers. Finally, of course, I think that's a very important aspect, because I totally believe that media is an influencer as well as an audience. So, if you expect the media to, deliver the messages, to be a source of information for the patients, for the people, we need to, have that knowledge exchange and a perspective exchange with the media as well. We need to equip the media with the right kind of information to be able to deliver it, in the right manner and at the right time to the listeners, to the audience. And I think, here the pharmaceutical industry, the medical device industry, and Neha, you would agree with me on that, can play a very, very important role. You are into physician education, you are into patient education. I think media as a stakeholder is very, very important, to be educated to, so we need to look beyond the story. But we need to travel a journey again with the media, wherein they can become our allies, they can become our advocates. So we need to feed them with information, and that will reflect in the way they report on issues. I'll give you a very simple example, and I'll keep it short, that, when we talk about rare diseases, when we actually, I have done a lot of work in rare diseases, and somehow I feel very, very connected to the issue, for various reasons. But, when we actually started advocacy around rare diseases, I will not name, but, there were some media who did not consider that, it affects a very, very small population. So why do we need to write about it? I think there is where education plays a lot of role, because in India, the base of, rare disease patient in itself needs to be, re-looked at. So I will not go into the specifics of it, but yes, media as an audience also needs to be involved. I mean, maybe education is not the right word, but involved in this process wherein information is given in the most impactful way.
Thank you, Ritika. I think that's a great note to end the panel discussion before I hand it over to Team Helen, Knowlton, Abhishek, and Ritika for their final comments and takeaways. Thank you, Neha. Thank you, Richa. I know you have a hard stop and want to leave, so thank you so much for joining in. Amir, not Dr. Amir or Professor Amir, but Amir, as you insisted. Sika sir, who had to log out, but gave us some fantastic insights on Vedanta, what Vedanta is doing, and the audience and all their questions. There were such fabulous questions which came in from the audience. Vinesh, who in such a wonderful way laid out the entire parenthood journey and the apprehensions, and very nicely conveyed the deadlines which can happen, and what are the options beyond the so-called deadlines for you. And so it's been a wonderful discussion, and I'd like to thank Helen Knowlton for helping us put this together, and Ritika especially for ensuring that we had the right kind of speakers and questions. Now over to Abhishek and Ritika for their final takeaways.
I mean, nothing much to add, but I want to first start by thanking you, Parul, because I know we come back to you month after month. So, and you've been doing this for us now for a quarter. So thank you so much. And it was just, it was extremely insightful for me personally in terms of attending the session. And it's just amazing to see the passion with which everybody talks about this subject. And I can understand when Amir mentioned that he's been talking about one subject for about 3 decades now and is still passionately talking about it. So it talks about the determination and passion that sometimes I think you need in this healthcare sector if you're working in the sector in India, because at times it can be frustrating. Having said that, I think one of the biggest takeouts, two biggest takeout for me from this one was obviously the fact that I think one is that broadly the misinformation or the impression that typically people have had around the whole focus around profitability that healthcare companies have, and how the conversation is shifting towards the fact that that needs to be, double down on the purpose part of it. And that purpose in this segment-based discussion is trust, credibility, and transparency, which is backed by evidence-based information. I think that, for me, was one of the biggest takeouts that, how do you kind of deep dive on that? And the second is this whole misinformation piece, which is scary, right?
Yeah.
And I don't think that is an area, or at least in a group right now, we've been able to find an answer to that, because there's always a Nicki Minaj or someone who is famous in India comes up and says something, right? And you have to understand the fact that misinformation is globalized. It's not only in India centric. I mean, Nicki Minaj was heard across the world, right? And then you also have these famous pictures of people jumping into the river to not get vaccinated, right? So I think that is a part that I think the ecosystem has to spend a lot of time on in terms of how do we push credible information forward. I don't think there's an easy answer to that. And the third part of this is, I think we park a lot of blame on the government. I don't think, I genuinely feel that in India, it's a humongous task. And while I agree that more needs to be done, and I think lessons we learned from the last 18 months of what we need to do in the future ahead, which presents a lot of opportunity. And I think the entire ecosystem, including communication and all practitioners over here, from academic to what Neha does and what Richa does and Vinesh and Mr. Sikka, need to all come together, because today's discussion just kind of opens up eyes on how everything is so interlinked, right? I mean, Rajiv is from an IT background, but how it's linked to this whole communication process and creating a trust and transparent experience for patients, to what Amir is doing from an academic perspective, to what Neha talked about, or Richa is doing from a consumer perspective, is so interconnected. And I think we need to have more forums which brings us together to address some of these issues.
Thank you, Vishek. I'll give the final word to you, Ritika.
Absolutely. I think it has been a fascinating discussion. Everybody was able to, we could gather such wonderful insights. And I think the questions were also, really interesting, and they added a dimension to, what we had already discussed as part of the panel. So finally, thank you everyone for, taking out time for this. Thank you, Parul and PR Moment team, for enabling this and, making this possible. And I feel privileged to be able to speak as part of the panel here.
Thank you, Ritika. Thanks. Final and most heartfelt thanks to all the attendees who've come in and taken time out to listen. All of you are very senior in your own right, and you came here to listen to us. So thank you so much. Happy weekend to everybody. Stay safe. Stay well.
Yes. Bye-bye. Thank you.
Thank you. Thank you, Parul. Thank you, Ritika.
Thank you. Bye.